I am Myra Cernosky.
I am Michelle Quimasin-Cruz.
I am Mariela Zuniga. I'm an occupational therapist.
I'm a speech pathologist.
I'm a physical therapist.
I am a UP camp graduate and very proud of it.
And a proud UP camp alumna.
And a proud UP camp alumni and a product CTS.
And product of CTS.
I am also a distinguished
and a distinguished
healthcare
frontliner.
Hi, everyone. Thank you for joining us this afternoon. Thank you for accepting our invitation to share your experiences as a camp alumna and therapist and during this COVID pandemic. So thank you, Michelle, Mariela, and Myra. Let's start by some introductions. Introduce yourself, your name, your profession, current location, and work setting. Mariela?
Good afternoon, everybody. Thanks for having me here. My name is Mariela Zuniga. I'm an occupational therapist, and I am currently in New York. I relocated from DC, where I met Jessie after all these years and reconnected. So I'm now in New York. I'm in the home health arena, but on the management side. But I had extensive experience in providing home health for older adults and also for early intervention for the population age 0 to 3. And that's where my CTS training kicked in.
Yes. Thank you. And Michelle?
Good afternoon. Thank you for having me. I'm Michelle Quimasin-Cruz, physical therapist based in New York. So I am in outpatient. For the first 10 years of my stay here in New York, my practice has been orthopedics, outpatient orthopedics, and then 3 years almost in acute care. But I also had experience in skilled nursing facilities and home care. And now I'm back to outpatient orthopedics, mostly geriatrics. But my experience in CTS has helped me with the multidisciplinary approach. So working with other allied professionals.
Thank you, Michelle. Myra.
Hello. Hi. Thank you for having me as well. My name is Myra Cernosky. I'm a speech pathologist. I am currently based in New Jersey. I am a proud UP camp alumna and a product of CTS. I've been in New Jersey for 23 years. And I am in an acute care setting. I also work with outpatients, both pediatrics and adults.
So you guys mentioned CTS, you mentioned camp, and I think that's something that we all have in common. I have, camp has always been a big part of my career and my training, and CTS will always be in my heart. That's why we're doing Rise Up. So what positive experiences did you have at camp or CTS? Start with Mariela.
So in CTS, that's the primary pillar of CTS is the interdisciplinary, as Michelle has mentioned earlier. And from then on, you get a flavor of all the disciplines. And I think the strong training and the collaborative efforts of everybody had strengthened your practice as a professional, because not only you're practicing as an OT per se, but you get to see the areas where you could improve on, and also translate that on the services that you provide for clients, especially for kids, and like in my sector of like older adults. So for me, the most positive thing was the interdisciplinary and being very creative, because of like some limitations, especially in the Philippines. You really are honed to be creative in your treatment. So those were my takeaways.
Thank you, Mariela. Michelle?
So CTS introduced us to pediatrics. It's my understanding that in later years, there were also an addition of adult patients, but during our time, it was mostly pediatrics. And that was the time that I realized, on paper, I wanted to become a pediatrician, but having seen our patients who have disabilities, I I felt that you have to have so much compassion as a pediatric healthcare professional, and that in and of itself really helped with my career, because this is not just something that is a 9 to 5 job. I tell my junior colleagues whenever I have any experience or a way to have students, that being bedside, being with patients is both an art and a science. And CTS taught us that.
Absolutely. Very nice. Myra?
I think Mariella and Michelle said it all. They were very articulate in sharing all the valuable things that CTS has taught us in terms of working with other disciplines and being collaborative and being creative. And especially back then, we didn't have the technology that we have now. So we did have to be creative as far as doing our research and being able to impart on our patients and their families the importance of home exercises and carryover strategies. So that has been ingrained in me since CTS days, and I'm very grateful for that.
Yes, those things definitely resonate with me, especially the creativity and not having materials. Myra, we started
Yes.
with speech pathology with a pen, a paper clip, a piece of paper, no materials, no
Absolutely.
assessment tools, but we learned, and that's definitely
Yes.
that's definitely a plus for all Filipino therapists, sure. Now going into the COVID situation, what were your responsibilities in dealing with patients in your setting pre-COVID? Have these responsibilities changed during the pandemic? Let's start with Mariella.
So pre-COVID, I went back to the field. I was providing direct home health in Washington D.C. And also doing the home assessments for older adults to age in place. So at that point, it was, it's very relaxed. It's at home, so people thrive at home. So you're in and out. But then COVID struck and is still around. So at like last year, the beginning of it, since nobody knew a lot of information about COVID, like spring of 2020, it was very stressful because just even donning and doffing your PPE, it's like, did I miss this? Did I have enough, mask on me? Did I have enough sanitizer? It was very stressful, like when it was like the cooler months. When things were kind of opened up like summertime because you can go outside. I think that was the time when um, people are learning more information about it, and so we deal as it comes. So in my company previously, we always had a weekly meeting on how to deal with certain things. Of course, you still remain very, very vigilant and a little bit paranoid in everything that you do. You super sanitize your hands. You're over putting any PPE. So it was a very big change from pre-COVID to COVID times. But I guess like as we live through it now, I don't want to say people are more relaxed, but outside of the healthcare system, that's what I see. People seem to be like more complacent, but I know we can still let our guards down. But Like from pre, it's like everything was carefree, but now, you exercise more caution than before, because as it is, it's still out there.
Right. Michelle.
So my experience with COVID is both personal and professional. So last year, I was an acute care bedside physical therapist in the hospital. So of course, as early as January, when the first cases came out of Washington, we were already having town hall meetings in our hospital. All travel were already banned. So continuing education outside of New York were stopped and discontinued, and even personal travel. There has been like directives that if you still go out of New York or out of the country, that the chances of you getting back and all these. So there were a lot of uncertainty, and of course, like how much PPE do we really have? So it's ever changing. And by March 20, I actually started having my symptoms of COVID. And it wasn't even the fever and the cough, it was more of the muscle aches and the diarrhea. And it took about 10 days before our hospital were able to offer testing for its employees. So it wasn't until 10 days later that I confirmed what I already felt I had. So for those 10 days, I was at home, trying to make sure that the rest of the family didn't get hit with it. But my husband also had COVID a few days later, and he even had stroke with the COVID. So our personal experience is that, for the next 3 months, we were in our medical leaves. So even when I missed much of the action bedside in the hospital, because I still had, the emails coming in. I stayed abreast with what was going on. So a good number of the therapists, the physical therapists at bedside became a proning team. So they had shifts where they stayed until 11 at night, and they would help prone patients bedside. And there was also therapists from outpatient, because elective surgeries were canceled or postponed. So outpatient physical therapists were redeployed bedside in acute care, just to make sure that the hospital didn't furlough or laid off physical therapists. They were redeployed to bedside. So while that was going on, I was taking care of my husband here at home, and we were recuperating from our own COVID infections. So when I got back to work in June, it was the same, bedside physical therapy. There was no, of course, physical distancing in healthcare professions, because you're helping patients transfer from bed to chair, and vice versa. The only main difference is, of course, like what Mariella has mentioned, the donning and the doffing of PPEs. So I know from our experience in Lung Center, for those who had rotations there, we were already using N95s when we would be bedside with tuberculosis patients in the Philippines. So this time, wearing it for at least 8 hours a day, with the face shield, with the gowns, definitely our faces broke out with acne, but that's the least of our our worries. So that was the main difference. And also, like, patients coming in, everyone gets swabbed already in the hospital. And there's instances where they're negative when they come in, and then a few days later, they develop symptoms, and they become positive. So, as Mariela had mentioned, it's ever changing, ever evolving. But again, that's one thing that we learned as UP students and CTS students, to remain resilient despite everything that that goes on around us. So it prepared us for this kind of situation.
Right, right. That definitely, again, resonates with me. And Michelle, if I can ask you a follow-up question about that,
Sure.
are there any residual symptoms that you are, experiencing now?
So one thing that most of us, because a good number in our department got sick too. And we've noticed that even those who are younger than me, it's easier to get tired. That's the long haul result of it. It really takes less to make us more tired. So that's one of the things that we noticed. And even for females around our cycles, some of our symptoms become heightened. So like headaches, muscle pains. So those are the long haul symptoms that we've seen.
Yeah. Thanks for sharing that. I'll circle back with that question, with a follow-up question for everyone later on. But Myra, how about you?
Okay, so like I've mentioned before, I've been in an acute care setting pretty much my whole career. I'm the speech therapy coordinator at the hospital where I work. When we started to get COVID patients admitted into our hospital, of course, there was the fear of, oh my gosh, are they going to order swallow evals? The first swallow eval came in, and even though I could have sent one of my colleagues to go in and evaluate the patient, I felt that I felt very strongly about leading by example. And so even, in spite of my fear of facing COVID, I felt that it was my responsibility to go ahead and see the patient and just get over my fears. And I'd like to thank the background that we were given at UP through CPS and Montalban and PGH. Just being exposed to different circumstances, I think, gave me enough courage to get through it. Especially for the sake of for the benefit of our patients.
Right. And we were saying too that that's across the board for all health professions. The Filipinos are always lauded for, our resilience, our going beyond the call of duty, going above and beyond, what's called for. And that's what sets us apart as a race, But going back to the pandemic, you guys kind of mentioned this already. What other challenges probably have you experienced as a therapist working with your patients with COVID? Also, were there any specific instances or situations that caused you heartache? I know you all have had those experiences at one point this past couple of years. Yeah. Mayela?
So in Washington, I think at that time, Washington is like a bubble, given that it's a smaller scale, and so it was more contained compared to the bigger cities. So I only had an interaction with probably 2 to 3 post-COVID, but then going in, like I was at the door and just trying to remember, mauna ba to? Or ito muna? Ano ba? Naghugas ba? Yung ganun ka naka-paranoid. Like, and then after that, did I have any spaces in between? Like, that paranoid. And then when you get home, literally at your door, you undress and then put it in the plastic and then straight to the washer, because it's just that. But like thankfully, I didn't have a patient who did not make it. But what was heartbreaking for me is knowing on a personal level people who did not make it. And like these people are good people. Also on a personal experience, like Michelle, I got tested in DC at that time last year. Testing is free. You just line up and you get tested for free. So I was on my way to New York a few days before that, so I got myself tested, and I tested positive. But then my only symptom was like scratchy throat. For me, I wouldn't even have noticed it or given it a thought. But then I had to tell my company, and then they had the protocol of informing patients, and everything like that. But it was also stressful for me knowing that what did I bring to their household. So every day I was calling my friend, the physical therapist, is this person still alive? Because I felt it in me to be like, what if I brought it in? So on the scary part, that was the piece that was challenging. And circling back, it's I guess like the way we learned, the way we were trained in UP, in CTS, in Montalban, and seeing across the board like those patients, your sense of compassion, I think, not just as UP grads, but I think as Filipinos in the healthcare field, it's it's probably innate in all of us to have that malasakit, and you don't see that in everybody. So it's very very special for um for Filipinos, and and like I said earlier in segue, with UP grads, you see not just the compassion but the drive to excel. You see that. Yeah.
Thank you, Michelle.
So definitely the challenges would be when I got back to work after our medical leave. So seeing the patients who were still there, who had the virus, and seeing them still struggling definitely from this. What struck me the most was a man in his 30s who was, we always hear, oh, those who get too sick are the ones with comorbidities, but this was a fairly healthy man. And he had a lot of like vascular issues. He had a lot of strokes, that he was in a persistent vegetative state. So, he was breathing to a trach tube. He was getting fed through tubes. And so one thing that you realize with this pandemic is quality of life, right? So we would say, okay, he survived technically because he's alive, but he's not really living. So that really struck a chord, because it could have happened to my husband. It could have happened to any one of us. So there was some survivor's guilt, especially with my husband. Like during the time, and this Mariela had mentioned as well, that you know we have patients, sadly we can't um, we can't save, but because it's a pandemic, there's also personal attack with us, because when my husband was in the ICU, another camper also had COVID, and her significant other was in the hospital too, but the outcomes were totally different. And so, I couldn't be happy that my husband got out, because 3 days before he got out, that friend passed away. So, yeah.
Sorry to hear that.
Still, yeah. And the fact that we couldn't even congregate to be with her during that time. And it took a year before we actually saw each other again. So Zoom and, technology, I was saying that it saved us somehow because it kept us connected. Imagine if this had happened when we didn't have cell phones, we didn't have the technology to stay in touch, there would be even, greater mental health issues. And that's another thing that I definitely valued during this time, are mental health professionals. And I also pray for them because, for them to hear all these that we're dumping on them, I'm sure it's going to take a toll on them as well. So all healthcare professionals right now, it makes us again more resilient, that we've seen that in our patients way back in the Philippines. So like Mariela had mentioned, Myra had mentioned, we all get that strength from our experiences in UP, in CTS.
Thank you, Michelle. Myra.
So my personal heartache from COVID was when, like, I think it was more of knowing that I was going into work every day and then exposing myself and then potentially my kids. Sorry, naiiyak din ako. I think it just brings back like all the emotional stuff from last year.
Yeah.
So anyway, so I ended up getting COVID as well in mid-April. And I think it was from an exposure with a patient who was in the hospital. I think that was what happened. Just being in her room for like over an hour and helping the nurse's aide transfer the patient from the bed and into the bathroom and back. I remember she lost her balance and her face touched mine. So I don't know, maybe it was that, or maybe it was the stress and the immune system getting compromised over time. So I did end up getting COVID, and then so I had to stay home obviously until I was all better. My symptoms were a little bit of GI, a little bit of respiratory stuff, just one episode of fever, but it was fatigue like I've never felt before. And so having to take care of my kids who were home doing remote school, remote learning for school, that was a bit of a challenge, trying to peel myself off of bed and making sure they're fed and paying attention to classes and completing their schoolwork. So, and still just the fear that I would pass on the virus to them. Eventually, my daughter did end up getting COVID, but thankfully her symptoms were very mild. I don't know how my two boys never got it, but I'm thankful. But that would be my personal heartache. It just knowing that I was potentially exposing my children, and but it's part of the job. And like Mariela and Michelle had mentioned, we have this inexplicable drive to succeed and excel in everything we do, and be it that might be professionally and even personally at home. We want to always do our best. And I really do thank UP for instilling that in us, because I think it's taken us very far, and it helped us get through the challenges that the past year has given all of us.
Oh my gosh, I had no idea that you all had COVID. Was it providential that we picked you? I don't know. Oh my goodness. But sharing your experiences with this throughout this COVID pandemic, it amplifies the strength, resilience, grit of the Filipino, especially the UP alumni, health workers. And I don't know, you probably don't know that I work with kids. And when we started getting back in the building, we had all these thoughts coming through our minds, and we didn't know what to do. We just went in and hoped for the best. But you actually went into the hospitals and went in and cared for patients with COVID, and that's even more challenging, more difficult, more traumatizing maybe. But you overcame all these challenges, and you kind of talked about how you did overcome some of these challenges. But was there anything specific that helped you transcend them? Anything, anybody in particular, or anything that you did that helped you go through these challenges?
So I think the value of connection, and I'm thankful for the technology, like what Michelle had said. If this happened like when there wasn't no Google, no Zoom, or it's probably a different scenario. So having that having the access to FaceTime, to WhatsApp, and all that was something that worked. For me, I guess, like for friends, we do like, okay, let's meet at this time, because you can't meet you as human beings. We are social creatures. We need that, being able to be part of community. So I scheduled like, happy hours on Zoom. Um, I tried to do long walks. Like, of course, when we say like social distance, like solitary walks, and just to get your mind off things and breathe, because at that point it was really everything was uncertain. You can't even be with family. You wanted to be with family, as a reassurance, but you can't. So you got to deal with the cards that you're dealt with at that time. So the connection, even though it's through technology, but it is what it is. um, and then just abreast to keeping abreast to what are the developments. Are we It gives you hope that there's the vaccine that's in the pipeline, that the colder months are going to turn into summer months, and there's a possibility to see your friends 10 feet away. So I guess, like, having been trained and growing up in the Philippines and seeing how it is in PGH and CTS and everywhere where we were, you always hold on to hope that things will be better. And I think we're seeing that now. It may not be how you want it to be in where we come from, like in the Philippines, you want it to be better. But I think here in the US, we're on that threshold of almost having us normalcy. Although we're not there yet, we can't like let our guards down. But having more, I'm grateful for having more contacts now with friends, like physically see them. And I think that's the most important thing. And as Michelle said earlier, you become more aware of what's important in life, and everything pre-COVID seemed to like have just fell off. Like, you know what, I could survive without that. Having lived through COVID, this is all I need. I'm good. So it's like that. It's like that for me.
Mhm. Yeah, thank you. Michelle?
So definitely, as Mariella had mentioned, connections, having such a support system, especially during trying times. And I think I broached on that earlier, mental health professionals. So we availed of the services from our hospital. We were very fortunate that the hospital where my husband stayed at, that was part of their post ICU care, to have counselors that actually follow with the patients who stay at their ICU, and also the guidance counselors of our kids' schools. They knew of our situation, so they would schedule meetings with our kids even through Zoom, um, and follow up with them and make sure that they're able to, you know, um, adjust with what's going on and again, having, that's also a connection in and of itself, right? And realizing how it is important to talk to someone, even, just as a sounding board, someone you can really just say, whatever you feel. And that's why even after that, whenever someone tells me, can I give you a call, I jump on the chance, because I don't want to miss that opportunity to pay it forward to another colleague. Just a couple of days ago, I have two separate friends in separate parts of my life who have told me that they're burnt out and they're depressed, and they feel like they don't have anyone to talk to. So thankfully, I was free when they asked to speak with me, and again, being able to pay it forward to someone else, as I have experienced that. So
Yeah, that's
thankful
great.
for that.
Yeah. Myra.
So same as Michelle, I benefited greatly from having mental health professionals help me through the difficult period that was last year. It was that, and having my family support me from afar. Thank goodness indeed for technology and cell phones and Zoom and FaceTime. I was also able to connect frequently with my speech colleagues and fellow graduates from camp, my batchmates, 1998. Just having the support from all angles was definitely a huge plus, necessity, call it what you may. Call it what you will, but it's what got us through. And of course, there's praying and going to church, and online. But maintaining a sense of spirituality, because that whole year, even till now, it's just bigger than us.
Right.
And you just can't go through it on your own. And that's definitely what I learned, and I'm grateful for all the people that have surrounded me through life and through this, and even my colleagues at work, just us all having the same experiences and the same fears, and being able to share that, being open with each other. I can't put a price on it.
Yeah, absolutely. Connections, relationships, shared experiences, plants, baking.
Actually, on a lighter note,
the cake. What was that?
yeah, on a lighter note, yeah, on the lighter note, like I tried my hand in baking, and I became like a plantita. And my sister, it's like, you have so many plants. Yeah, it's connection with living things.
But
And then
painting.
yeah, and then I paint. I mean, anything. I mean, as it is, when we talk about mental health, anything that would help you go through it. So I tried. I mean, I went for long walks. I went hiking. I did painting. That has nothing to do with what's going on in health. I had to do that. It was the survival. There was a point when I was diagnosed, I don't want to go to sleep, because it's like, what if I don't wake up? What if I don't wake up and nobody would know? So I would keep. Thankfully, we're 12 hours difference with Philippines. So it's like, can you just talk to me at 2 a.m.? Say, why are you up? I'm scared to sleep, because it's like, I don't know, maybe I won't make it. It's like, come on, Mariela, it's fine. But that was the fear. But at the same time, it's not letting that keep you from living. So the flip side of it is like I try to live like with my painting, with my walking and all that. And then when it was safe to go swimming in it, I did that. So yeah, I guess as it is, it was a very, very tough year. And especially when it's winter, that was the time when it's so dark and you question your purpose. Is it really worth it? You go in that depths of,
Into a dark
because
space.
the dark doesn't help. But as it is, the resiliency, the way we went through things back in college, you have to dig deep to
Way,
get
way deep. Really,
super,
really
yes,
deep.
deep. And then you can't let it beat you. You have to fight back and then just live. Yeah.
Yeah. Anything to add, Michelle or Myra?
No, well said.
Well, just like what Mariela said, interestingly, as a family, we went on more outdoor trips after our experience. So as early as July last year, we were going to farms, we were going to hikes and waterfalls. And I guess it's because of the fever as well, our kids being at home with remote schooling. So whenever we had a chance to go out as a family and then just breathe the air without any other people around, that definitely was helpful and still is, because just this past July we were able to go on a road trip, and experience stuff that are like one and done things like river tubing, and all those, and just like Mariela said, enjoying life and not letting it get you down.
Yes, very well said. You really had to rethink about your priorities in life. It all comes down to family, friends, relationships, like you all have said. What would you think is the greatest contribution of the Filipino therapist during this pandemic? Just one word or a phrase. Mariela.
I guess when you say front line, we're really on the front line. We're there. And I think like based on reports, and they're like, even not just as therapists, but the nurses, the Filipino nurses, it's a big percentage of them who really sacrifice not just their efforts but with their lives. So the essence of being frontliners and that extra compassion, the Filipinos are up there above and beyond. And like how UP trained us in CTS, looking at every angle, being more, you're not siloed in CTS. You cover everything. So even now with practice, it's like, yeah, I know a little about that because it was instilled in me. So it makes you more, your stuff, but at the same time you're a generalist on like what's going on with everything. And then I think for a big part of it is like for Filipino healthcare workers, it's just being on the front line, like front, yeah, just that, the compassion and the passion to do this, to do what we do. Yeah.
Right. Michelle.
I would say my favorite shape, heart. That's where everything comes from. So this pandemic had shown us what we're really made of, and that's coming from the love that we have for our family, for our friends, for our patients. Because otherwise, it's just easy to say, okay, I'm done.
Yeah.
I'll move on. And even then, we're still here. We're trying to be part of the solution. So that's
Right.
it.
Very nice. Myra.
I agree with Mariella and Michelle that Um, I think what sets the Filipino healthcare worker apart is the innate compassion that we seem to just have and portray, not just for our patients, but also for our colleagues, for our, the other disciplines in healthcare, and acknowledging that we're all part of a team.
Whew, I don't want to end this because this has been such a revelation and very inspiring, words from you guys. Speaking of inspiring words, moving forward, what would be your message to the young therapists, especially our UP camp alumni or interns? If there's anything you want to impart to them to inspire them, what would that be?
I would say keep your integrity, keep your training, and have a good heart. It will bring you to so many places. It would set you apart from everybody else.
That's true. Michelle?
This I've shared not just to Filipino junior colleagues, but the students that I've had the pleasure of working with here in the US. Keep the fire burning. Sometimes the fire is a flame, sometimes it's just a small one. But once the passion is there, it will never leave. So while I did leave the hospital setting, I still kept with being a physical therapist by working with senior adults now in an outpatient facility. So that's also what's good with our profession, is that we're able to keep reinventing ourselves and finding ways to still be relevant and help.
Myra. Right.
So it's an understatement that the past year has brought us challenges. Challenges that we never anticipated. It was definitely a huge curveball. So what I would want the younger generations of campers to try and keep in mind is that challenges will come. Be prepared. Try not to shy away. Use the tools that UP has given us, because it's definitely taken us very far. And I think it's also important to nurture your love for your profession, because not only does it give me a sense of identity, but it does give me a sense of purpose in my life.
Oh, you guys are so inspiring. Ladies, I have to say, I knew all of you when you were students. Michelle, I do remember you when you were in CTS. Your training as well as your attitude in life has taken you places like Mariela has said. And I'm so proud of what you have accomplished in life, in your career, and your stories are very inspiring. I'm so glad to see you all. Thank you so much.